And the first case is a 38-year-old female who is a known case of type 2 diabetes mellitus, was tested positive in May 2021 with a CT severity score of 11/25, was hospitalized in the outside hospital for 11 days duration, requiring minimal oxygen support. And in view of the elevated markers, she was started on remdesivir injection and injection dexamethasone 8 mg BD for 10 days, followed by oral steroids tapering dose of 8 mg, followed by along with low molecular weight heparin. And she was discharged home. After months of being treated with COVID, the patient came with a complaint of cough with blood stained sputum, that's a streaky hemoptysis, for 1 week, and she also had a bout of one episode of 600 ml of hemoptysis. With this, the patient reported to us, and there is no history of fever, there is no loss of appetite, no loss of weight and shortness of breath. She is a known case of type 2 diabetes mellitus for the past 5 years under treatment with oral hypoglycemic agents. Patient was admitted under pulmonology. On admission, patient was hemodynamically stable, maintained room air saturation. On routine blood investigations were done, all were normal, and antibodies to SARS-CoV was also reactive. This is an X-ray chest taken at the time of admission. You can see a cavity here with some amount of consolidation with the cavity in the left upper lobe, and you can also see some patchy opacities in the right upper lobe, which may be because of the recovering of post-COVID. So, with this we proceeded with the CT. CT showed a thick-walled cavity in the left upper lobe. You can see this may be because of the hemoptysis. This is a ground glassing, and you can also see some fibrosis. This may be the post-COVID fibrosis on the opposite side. This is a lesion with the cavity, with the thick-walled cavity. As you all know, in India, most commonly we think of a tuberculosis if you have a left upper lobe cavity lesions. But in this case, the sputum came as negative, so we proceeded with a fiber optic bronchoscopy. And you can see this is a vocal cord, this is a carina, this is a, in the left upper lobe bronchus, you can see the fleshy material obstructing the lumen, and the biopsy was taken, and the bronchial was sent for AFB, gene expert, galactomannan, gram stain, fungal culture, fungal smear, and we also suspected nocardio and actinomycosis, and the biopsy was also sent for histopathology, and AFB gene expert and special stains for nocardia and actinomycosis were negative, but 10% KOH fungal smear came as a broad spectrum aseptate hyphae was seen, and galactomannan was positive. This gives us a clue for the diagnosis of pulmonary mucormycosis. This is a picture showing an aseptate hyphae, and the patient was started with a strict diabetic control according to the endocrinology opinion, and for hemoptysis the patient was started on injection trapic, and patient once diagnosed as an mucormycosis, the patient was started on liposomal amphotericin B. A cumulative dose of 3 grams were given, and were monitored with the daily urine and creatinine level to rule out any nephrotoxicity because of amphotericin, and electrolytes and renal functions were tested, and after treatment the patient was started on posaconazole 300 mg, and the patient was symptomatically now. The patient was discharged under regular follow-up now. And COVID-19 associated mucormycosis, severe coronavirus COVID-19 is currently managed with systemic glucocorticoids. Opportunistic fungal infections are concerned in such patients. So, in patients with this, we have to suspect any patients who are on treatment with steroids, who are on a diabetic, and post-COVID, you have to think of mucormycosis as also one of the differential diagnoses along with pulmonary tuberculosis in India. As you all know, the incidence of mucormycosis is globally 0.005 to 1.7 per million population, but India is the second largest population with diabetes, with the prevalence of mucormycosis is estimated to be 140 per million population. That is 80 times higher than the prevalence in the developing countries. So, as you all know, we are already in more prone for mucormycosis in diabetic patients, along with COVID-19 and along with the treatment of steroids, they are more prone to get mucormycosis. And In May 2021, the several states in India have been made mucormycosis as a notifiable disease. Current trends indicate that surge in higher in those with pre-existing diabetes or those who are on injectable corticosteroids, and with COVID-19 recurring patients, this is more common, and it is as you all know, we also have a diabetes in India is more common. So, the COVID-19 with those patients who are on injectable corticosteroids and the diabetes, they are more prone to develop mucormycosis.